and I think those of you that were here for the first panel thoroughly enjoyed that. The next two panels are going to be excellent as well. Just a couple of housekeeping things. First of all, in your packets, you have conference surveys, and we ask that you fill those out. You know, every conference you go to has a survey, and you think, what do they do with them? Well, we use those, and we look at them very closely. What we try and do is improve upon this conference, make it better for you, more meaningful for you next year. So please fill out those surveys and leave them at the registration desk if you would. Also, as Dan said just before the first panel, if you are not currently a member of the Washington Policy Center and you would like to receive our publications, please leave your business card, your contact information or something with the desk, and we will pick that up and get you on our mailing list. It's really a great way to stay in touch with what we're doing at the Policy Center and what we're writing. It is my pleasure this morning to introduce the moderator for the New Trends panel, Dr. Sheila Regge. Dr. Regge is a member of our Healthcare Advisory Board and is an active participant on the advisory board. Dr. Regge did her undergraduate work at the University of California at Berkeley and did her medical training and radiation oncology training at the University of California in Los Angeles. She is a board-certified radiation oncologist. She practices at the Tri-Cities Cancer Center. She is also on the governing board of the Tri-Cities Cancer Center. She is on the faculty at the University of Washington as well as the faculty at UCLA. She is involved nationally. She is on the board of chancellors for the American College of Radiation Oncologists and is an alternate delegate to the American Medical Association from the state of Washington. Dr. Sheila Regge.
Can you hear me back there? First of all, we don't have a single lawyer, a single legislator here. I'm a practicing doctor, and we have 2 doctors, and 1 nurse, and 1 person who is in the insurance business. So, unfortunately, it's not going to be quite as sparring. We're going to be pretty supportive, but if you want to ask us tough questions, feel free. Thank you again for coming. I think healthcare has become the new hot topic in America. Most of our studies show that most Americans like their own doctors, but everybody seems to agree collectively we can and must do better. And there are a lot of thoughts out there about how we can improve healthcare, quality, access, holding down costs. The question is, which of those models are going to take us there? Because in general, most of us like our doctors and like the healthcare we get, especially if we have insurance. We are lucky today. We've gathered a panel of pioneers. They have first-hand experience in testing out some of these models on improving healthcare. Our format is going to be each of these speakers is going to talk for about 15 minutes, and then we're going to have a good 20 to 30 minutes of questions. At the time of questions, if you could come to these 2 mics set up here in the middle, I know you're going to have to scoot chairs and stuff to get out of your seats there, and then ask the questions. I'm going to introduce each speaker very briefly. They have extensive bios. It's in the binder. Please write down your questions. You've got little pads on the tables there. And we look forward to hearing from you